My name is Derek, and the reason that I come to see Dr. Mathur was my family has a history of high blood pressure. I'm at risk for a lot of things because I'm a type 2 diabetic. I'm at risk for heart attack, stroke, kidney failure, and I saw this as an opportunity to seek a second opinion because I wasn't satisfied with what the doctors were telling me. And when I came to see Dr. Mathur, she was open-minded and she was more concerned about what I had to say versus what the symptoms and what the lab results revealed. I was experiencing loss of muscle tone. It didn't seem like I had the energy that I used to have. And I'm like, wait a minute, something's not right. This is not part of the aging process as my family told me about, that wait a minute, you're going to get old, but not like this. It's not going to hit you all at once. And that's the way I was starting to feel like it was just getting me all at once. A lack of energy prevented me sometimes from getting out of bed when I was supposed to, listening to the alarm clock and saying 10 more minutes, 15 more minutes, just not wanting to get up. After that first treatment, I felt like I was 15 years younger. And I was buzzing around. I think I got off work, had the treatment, went home. I was up until 4 in the morning, went to sleep for 2 hours, felt like I had slept for 8, got back up and did it again. I'm like, I would recommend that for anybody, but that's just how much energy I had. I felt like I could go on and on because that's the way I felt like 10, 15 years ago. And I wouldn't stop a task until I completed it. And so I was kind of in that mode after the treatments. It was like, it's time to get some work done out here because you have the energy. Overall, I'm thrilled with the benefits that I achieved just from the first treatment alone. I've been receiving Ozone treatments. That's where they take out a pint of your blood and they infuse it with the highest form of oxygen with ozone. And what it does, it turns your blood a bright red in the bag. It's the collection bag. And once they infuse the oxygen into your blood, it turns a bright red, and then they put it back in. And what that Ozone does is it goes in there like the mob. Now I won't say the mob, but like the cavalry. That's a better description. And it viruses, bacteria, it just energizes the blood because maybe I know a little bit too much about this thing because I'm a nurse, but cancer cannot exist in an oxygen-rich environment. It's like it makes anything that's not supposed to be in your blood, those Ozone treatments just say, get out of the way because I'm in charge now. And when you have more oxygen in your blood, you have more energy. And it's a no-brainer. The less oxygen you have in your body, it's like you're choking off your body's supply of oxygen. So those treatments make all the difference in the world to me. My family has a history of high blood pressure. My mom, who was 83 years old, she had a stent put in her heart to keep her, her valves open. And to me, this is like preventive medicine for me because I would rather receive a treatment that removes the plaque from the arteries instead of putting something in there that opens it up. It doesn't, in other words, it's just creating an airway, but it's not removing the problem like chelation does. Chelation takes the calcium deposits, the heavy metals, the mercury, the lead, the whatever's not supposed to be in there, aluminum, even arsenic. Anything that doesn't belong in your blood, it binds to it, and after receiving it, it just goes out through your urine and through your stool. I found out a number of things. In addition to the treatments, they also put me on the 3-week liver detox, and I noticed the results right away. I have more energy. Whatever I put in my body is being absorbed properly because I can feel it. It's one thing to say it, but I can actually feel it. I can feel the difference. So before I was taking a handful of vitamins, I was eating whatever I wanted to eat, and my liver became clogged up. That 3-week liver detox unclogged everything, so I don't have to take as much as what I was taking. And besides that, it wasn't doing me any good anyway because my liver was clogged up. So I'm spending a fortune on vitamins that I don't really need as much of. And once that opened up my liver, it's like it opened up a lot more possibilities for me to get better. Not to mention saving some money in the process. So I feel good about that all the way around. Her caring attitude, she's hands-on. She doesn't assume anything. She directs. In other words, she asks me questions that tell her about what my needs are. When the subject of my type 2 came up, she says, now you're giving me something I can use. Because before that, you weren't really giving me enough information, but now I got something for you, okay? If these are certain things that are going on with you, your estrogen levels are high because of your diet. First we need to get you to a nutritionist and change your diet. I'm like, okay. Because, and you need to go organic. We need to get you off of grains, and we need to get you off of dairy products, and go gluten-free to the best of your ability. Your estrogen levels are way too high. You probably got more estrogen in you than I do right now. I'm like, oh no, ooh. From that point on, I'm like, okay, what can you do for me? I'm gonna put you on a testosterone supplement based on your needs, because all patients are not alike. This is based on your needs. What works for you may not work for somebody else, but I'm gonna put you on a prescription that I'm sure will work for you. And your estrogen levels will go down, testosterone will go up, and will also help with your type 2 diabetes. I'm like, really? Then I looked at her and I said, doctor, it's hard for me not to look at you without seeing your halo. She just, and then that was it. We just go from that point on, we had a beautiful relationship. I'm excited about getting better. I'm excited about the possibility of how I'm going to feel 10 years from now, a year from now, 20 years from now. I do not want to be a candidate for open heart surgery. I do not want to have my kidneys replaced or be on dialysis because of the risk factors associated with type 2 diabetes. I don't want to go blind because I'm not eating the right foods. To me, the best thing I can do right now is to prevent whatever could happen if I don't pay attention to what the doctor says. And I trust this doctor. Does this mean I get a chance to be bad? No, I'm kidding. Big benefits for the testosterone therapy. All I can say is big benefits. I believe it at that.